Thank you, Chair. I'd also like to join other deputies in thanking Deputy Connolly and her team for bringing forward this very important motion. Over the past year, I've had to repeatedly raise the issue of restrictions in maternity hospitals. Despite reassurances that this issue would be dealt with, it wasn't. While the rest of society had opened up, while we could even go to the pub, mothers were and still are expected to go through labour mainly alone, while partners are lucky if they get to attend the birth of their own child. Reflecting on this past year, it is very apparent that pregnant people do not have a lobby group and that they are not an economic priority. A year later, you've made some efforts to address this, but not enough. For example, last December, the HSE reclassified partners as essential accompanying persons for the purpose of the 20-week scan, but then somehow become unessential for the remainder of the maternity journey, which makes no actual common sense to anybody. That the Minister left now, I think really says it all. Maternity services are relegated because they are a women's issue, and they are overlooked because they can be. But this is changing, and it is changing fast. The recent maternity restrictions campaign has shown incredible solidarity, not only the people currently affected, but other parents. Other women are showing an incredible solidarity. Families are sharing their stories of miscarriages and the need for more supports. There is a new strength of purpose in ensuring that maternity services are better for the next women coming in the door, and the government would do well to note that solidarity. Today's motion brings us to the reality of implementing a strategy that is about resourcing, staffing and paying for the healthcare parents and babies are entitled to. Crucially, we need the staff and facilities to run a safe and dignified service. Last year's HICWA report into maternity services outlined how midwifery staff are working overtime to address staffing deficits and maintain service levels. The INMO have consistently highlighted that our midwife to birth ratio is much higher than it should be. The government must implement robust recruitment and retention strategies to make nursing and midwifery careers more attractive and to ensure that all our nurses and midwives in training are properly paid and have the option for working in Ireland. Disgracefully, there is essentially no consideration of disabled women in the current strategy. Witnesses of the Disability Matters Committee have highlighted the systematic barriers they face, including lack of proper infrastructure, absence of interpreters, and inadequate information for informed decision-making in all aspects of maternal health. The strategy implementation plan needs to consider the needs of people with disabilities as well as vulnerable and marginalised groups. This motion rightly insists on the public ownership of the new National Maternity Hospital. It is unbelievable that in 2021 we have to even discuss this. Maternal health care needs to be free of private interests or religious control. It is intolerable that a particular ethos would determine what health care we get rather than medical need. The Minister needs to give an absolute guarantee today that the new National Maternity Hospital will be publicly owned and operated. The current National Maternity Strategy is Ireland's first. As we pass through a decade of centenaries, we are reminded it took almost 100 years for this state to take a properly organised approach to maternal health care. Instead, women were too often sent to institutions. The mother and child scheme was heavily resisted, and until 2018, those who needed abortion care were shipped abroad. These realities reflect the position of women's health care in our society. And in case you think I'm exaggerating, read the motion. The only reason we have a national maternity strategy is because of the very tragic death of Savita Halappanavar. As well as the specific findings surrounding Savita's passing, the HICWA report highlighted the lack of coordination and inconsistencies in the provision of maternity services. For the National Maternity Strategy to mean anything, it must be implemented and resourced properly. It is outrageous that we need this motion, but we do. The government needs to listen. We do not need lists of the achievements the Department of Health has written out for you. We need real political decision-making to immediately provide comprehensive, time-bound and fully cost-implementing plan. Anything less is unacceptable.
Good.